Good afternoon. This is Dr. Deepa Easow, Senior Consultant Pediatrician from the Department of Paediatrics at MGM Healthcare. This is another one in the series of talks that we have been doing on childcare. And I'm sure today's topic is definitely going to interest a lot of our dear parents outside there, because I'm sure this is a topic, this is a common condition that you would have met with dealing with your children, because it is a condition that is seen very commonly in children, and that is tummy pain in children. How many times have you got your child ready for school in the morning and all of a sudden the child says, I'm having a tummy pain? Or how many times have you been trying to feed the child in the afternoon, give the child their lunch, and all of a sudden the child starts complaining of tummy pain? So many a time the parent is not sure as to whether to take this seriously and take the child to the hospital, investigate it, or just ignore it. So today I hope by the end of the talk, I will be able to clarify that, and you will know which are the times that you need to take your child's complaint seriously and which are the times that you can kind of ignore that complaint. So tummy pain in a child can occur at any age. So it can start off from the newborn to the infant to an older child right up to an adolescent. And the causes differ based on the age. So an infant, a child less than 1 year complaining of tummy pain, usually we tend to take it more seriously, though it could be just a common cause of colic. It could be just colic, and that is not, that's a benign. How does a child who cannot verbalize communicate with the parent that the child is having a tummy pain? Usually these children will start having episodes of crying. They usually lift their legs up onto their abdomen and they start screaming. They'll have poor feeding and they become very fussy. So along with this, if there are additional complaints such as vomiting, and especially vomiting, bilious vomiting, that is greenish colored vomiting, or something like that, or blood in the stool, usually those are dangerous signs, and those are signs that show that the child should immediately be like that. Usually children who are usually thriving well, gaining weight well, and they usually become fussy, usually at a standard time during the evenings, and they start screaming for a couple of hours. They usually get a relief when they pass gas. They're gaining weight well. So these are the kids who are usually presenting with colic, and that is not something that is worrisome. Usually that settles down once the child is started on solid feeds. Now coming to older children. Now older children, or a normal child, a healthy child suddenly presenting with an acute onset of an abdominal pain, and the child, refuses food. See, the dictum is a healthy child, a child who is normal will usually have a good appetite. So the moment a child's appetite is affected, that usually is an indication that there is something wrong with the child. So this child suddenly has a bout of abdominal pain, doesn't want to play, goes and lies down, refuses food, and refuses to be touched, doesn't want to be touched, and just wants to lie down. These are indications that there could be something more serious. And if this child after an hour or so starts vomiting or starts having loose stools, those are indications that this could be something more serious. So what are the serious causes that we are worried about in this age group? One is an acute appendicitis or other surgical causes for an abdominal pain. So that usually starts with it can start very abruptly. The child will just complain of abdominal pain and usually will just go and lie down and will refuse to want to be touched. Usually the pain will be around the umbilicus and it will start off like that, and then soon it will go down to the right lower quadrant of the abdomen, and the child will refuse to be allowed to be touched by anyone, refuse food, could have a low-grade fever, could start vomiting, and could have constipation or diarrhea. So these are all indications that this is something serious and the child should be looked at by a pediatrician immediately. Now, what is the other cause of abdominal pain in children? Usually it could be just an infection, something that the child has eaten. Maybe the child had some outside food and all of a sudden the child starts having abdominal pain. In an hour or so, the child starts vomiting, has a couple of episodes of loose stools. So that could mean that the child is having an infection, which could be either viral or it could be bacterial. Now, the abdomen is the area anywhere between the rib cage, below the rib cage, right up covering the genitals. So this is a compartment that includes both the gastrointestinal tract as well as the genitourinary tract. So that means that anything affecting any of these organs in both these systems can cause pain in the abdomen. So just gastritis, a child has a spicy food, has had a heavy food which is full of fat, the child can develop abdominal pain, which is usually restricted to the upper abdomen. It could be just an attack of a gastritis. Then a child even presenting with symptoms of urinary tract infection can present with abdominal pain. So it is important that in this condition we tend to ask the children whether they have any pain when passing urine, or do they feel like passing urine very frequently. So if there are symptoms like that, then we would suspect that the child could be having a bout of urinary tract infection. Then it is very important, especially in male children, to ask them if they are having any pain anywhere near the genitals, especially near the scrotum, because there is a very serious condition that occurs in male children that can present with abdominal pain, and unless we examine the scrotal area or the genitals, there is a tendency to miss that, and that is a condition that should be immediately taken care of by a pediatric surgeon. So these are some of the things that show that there are serious causes for the abdominal pain. Now, what are the other causes for abdominal pain? A very simple cause for abdominal pain could be a child who is constipated. And a child who is constipated, 3-4 days, the child has not passed a stool. These children have abnormal bowel motions of abdominal pain. Now, there is something else which can cause something known as referred pain. That is a problem elsewhere, not in the abdomen, but it can cause pain in the abdomen. For example, a child presenting with pneumonia can present with abdominal pain. So that is also something that we need to think of, whether the child has got any other symptoms. Now, a child having fever along with the abdominal pain is usually worrying, because it could be a presentation of a condition like dengue. Dengue fever can present with abdominal pain. And abdominal pain in a child who has dengue fever is usually a dangerous sign. So it is important that any child who has fever along with an abdominal pain should be important cause that I would like to highlight is any child who has just come back from play, the child has taken part in a football match or any game, and all of a sudden comes back home and then is lying down complaining of abdominal pain. Definitely a history of trauma should be elicited. So you need to ask the child whether the football came and hit the child very hard, or whether the child had a fall where the child went and hit the abdomen on a parapet or something like that. Because that could be one of the causes, because there is some kind of a trauma to the internal organs, and that could be the cause of the abdominal pain. So these are some of the things that we need to ask. So if a child just complains of abdominal pain, and then a few minutes later the child is running around playing, or when the child's friends come and call the child and the child is up playing, half an hour later the child is asking for food again, that usually shows that it is not anything worrying. It could have been just gas, could have been just colic, and you don't need to worry. But along with the abdominal pain, if the child has got these associated symptoms such as fever, intractable vomiting, or the child continues to vomit, or the child is having loose stools, multiple episodes of loose stools, or stools with blood and mucus in them, these are all warning signs. A famous British pediatrician known as Apley once said that the further the pain is from the umbilicus, the more the chance of it being something serious. So most children, when it is something very benign, they will usually complain of pain around the umbilicus. So usually that indicates that it is not anything very serious. So it is important that when you ask a child, where is the abdominal pain, you need to ask the child to point with one finger and tell you where the pain is. So if the child points and generally says around the umbilicus, usually that indicates that it is not anything very serious. And The other type of pain that we usually see in children is something known as chronic abdominal pain. So supposing this is a child who complains of pain and then after an hour the child is fine. But this keeps happening recurrently, almost every day or every other day, with periods in between when the child is absolutely normal. But again, the child keeps having abdominal pain. So if this keeps on going for a month or two, usually we would label that as a chronic abdominal pain. And this is something that we need to look into, because it could be something which is causing the problem. There could be an organic cause, or it could be something known as functional abdominal pain. So chronic abdominal pain, as according to the new definition, is anything that occurs for more than about 2 months. So if a child is complaining of symptoms almost on a daily basis with periods in between when the child is absolutely normal, that usually we label the child as having chronic abdominal pain, and that is something that needs to be looked into. So under chronic abdominal pain, the most common cause is functional abdominal pain. There is a small percentage of children which have got something organic associated with them. It could be anything like a gastroesophageal reflux, or it could be something like a celiac disease or a Meckel's diverticulum, or any condition like that, which can usually be detected. So it is important that these children with chronic abdominal pain are investigated so that we know what it falls into. And if it falls into a chronic abdominal pain with an organic cause, it can be treated. Now, this entity known as functional abdominal pain, which is almost, almost 10 to 20% of our school-going children usually present with this condition known as functional abdominal pain. So just because I use the term functional, that does not mean that the child is fabricating the symptom, that the symptom is not there and the child is just telling you that the symptom is there. No, the symptom is very real to the child. But the reason why we call it functional is because all investigations done, for example, we do scans, we do blood investigations, we do scopies, we are unable to find any anatomical or biochemical or pathological cause for the pain. So that is what it means. That means the child is basically in the abdomen, everything is normal, but the child definitely does have the symptom. Now, why does that happen? This is because there is a dysregulation between the brain and the gut. See, our gut is an area which is innervated with a lot of nerves, and our gut and our brain are in constant communication. I'm sure all of you know that, because the moment you start feeling anxious or the moment you are tense, what happens? Immediately, you start feeling like going to the toilet very frequently. You start you feel you have butterflies in the stomach and things like that. So symptoms are very much there when you start feeling anxious and all. So why does that happen? That is because there is a connection between our brain and our gut through chemicals, through hormones. So in these children, what happens is the brain becomes hypersensitive to the normal physiological functioning in the brain, in the gut. So normal motility of the gut, anything that normally takes place in the gut is conveyed to the brain, and the brain starts showing it as pain. So this is like, for example, you have your house and you're going on a trip and you have a burglar alarm installed. So what is that burglar alarm there for? It is to warn you in case any person breaks into the house. Now, supposing a fly just flies across and the burglar alarm starts ringing. So what would we say? We would say that the burglar alarm was being hypersensitive, and we need to reset the burglar alarm, because that is not what it was meant to be. So similarly, our brain, which is not supposed to be processing normal physiological processes, for some reason it starts processing it as pain. It becomes hypersensitive to it. So it's a dysregulation between the brain and the gut. So when this happens, what happens is normal things that take place in the gut itself is portrayed as painful stimuli to the brain, and the child starts having pain. Now, why does this happen? This could happen after an infection. So the child is just recovering from an infection, and then for a couple of months, the child's gut starts becoming, the brain starts reacting very sensitively, in a hypersensitive manner, to anything that takes place in the gut. So that could be one reason. There could be a genetic component to it. So somebody in the family has problems like that, such as irritable bowel syndrome or migraine or anything like that. Similarly, the child can have things like this. But in many children, we are unable to find a cause. It could happen for no reason at all. But these children definitely do have pain, and it definitely affects their lifestyle. They either are unable to go to school, or they come back from school because they are complaining of pain and the symptoms are extremely real to them. So this is a totally different entity and it needs to be taken care of. So these are some of the causes. So I've told you that there are local causes for the abdominal pain, and there are causes that are outside the abdomen also, which can cause abdominal pain. So the important things that I would like to tell you here is, what are the red flags or what are the warning signs that it is something very serious. One is a pain that wakes up a child in the night. A child who is playing around during the day and goes to sleep peacefully through the night with no problem. Usually there is nothing very serious. In between, during the daytime, the child might come to you and say, my tummy is paining, and then back again to play. And in the night, the child is not disturbed. That is usually nothing very serious. But if a child is getting up in the middle of the night and crying because a child is having abdominal pain, usually that shows that there is something more serious. Now, along with this abdominal pain, if there are associated symptoms such as fever, or there is a rash, or there is joint pains, or there is loss of weight, the child is not growing appropriately, there is a delay in attaining puberty, or as I said, there is intractable vomiting, there is blood and mucus in the stool. So these are all signs that there is something more serious. So these are the red flag signs, and we need to look at these, watch for these signs. And if all of this is there, definitely the child needs to be brought into the hospital and investigated. So once the child comes into the hospital, what can you expect? So a child presenting with an acute abdominal pain, and we are suspecting a surgical cause for it, or we want to rule out a condition such as appendicitis, which needs to be taken care of immediately, we usually involve, along with the pediatrician, usually a pediatric surgeon also is involved, and usually we tend to do a few investigations to help us in a diagnosis. So we usually do something known as a complete blood count to look for infection, to see whether there is infection causing this whole problem. And we usually do something known as an ultrasound abdomen, which is a non-invasive investigation. It has no radiation, so it is a safe investigation that can be done for children. And usually this will help us in our diagnosis. Now, when it comes to chronic abdominal pain, of course, as I said, most of it is a functional abdominal pain, but still there is a small portion of it which can be organic. So it is important to rule out those organic causes, as well as it is important to reassure both the parent as well as the children that this is not anything very serious. So we need to do certain investigations to reassure both the parent as well as the child. So at the same time, we shouldn't go overboard doing too many investigations. So there is a balance that we need to strike, because doing too many investigations also can aggravate the whole condition, because as it is, the child is very anxious and the child is very concerned about the pain. So if you keep doing a whole load of investigations for that, that could aggravate the whole situation. But at the same time, we need to do the basic investigations, such as I said, again, it will be a complete blood count. We would do a urine examination to rule out a urinary infection, and then we would definitely do an ultrasound abdomen. And if maybe sometimes we might have to do a CT scan, and definitely some children we have to do a scopy to rule out certain conditions. So these are certain investigations that need to be done. Now, coming to what can a parent do at home if a child is complaining of abdominal pain. The important thing that we need to do if a child suddenly complains of abdominal pain is, do not force the child to eat. So a child having abdominal pain, feeling very uncomfortable, parents are usually very concerned, my child is not eating. So maybe it is because a child is not eating that the child is having abdominal pain. So forcing a child to eat at that time could aggravate the whole situation. So it is important that we just leave the child alone till the child feels that the child is ready to eat. But at the same time, it is a good thing to try to keep the child hydrated. So it is good to give clear liquids, especially as sips if the child is up to taking it. So that is something that can be done. Definitely things like carbonated drinks and caffeine and things like that should be avoided. Definitely all medications should be avoided, especially in a case of acute abdominal pain, because we do not want medications to mask the symptoms so that we are unable to detect what is going on with the child. A lot of people tend to give a lot of native medicines, saying that it is gas and indigestion and things like that when a child presents with abdominal pain. which might not be a very good idea because many of these native medicines can cause side effects and which can turn out to be quite dangerous, especially if the child is having a serious condition. So the important thing is at this time, allow the child to take rest. If the child wants to lie down and take a nap, if the child is able to do that, it is good to allow the child to do that. And if the child is fine when the child gets up, then that is fine. The other important thing is if the child has not passed stool for a couple of days, it is good to encourage the child to use the toilet so that the child, sometimes if the child has a motion, the child's abdominal pain is relieved. So that is something that can be encouraged. Other than that, medications should not be used without consulting a doctor. So these are some of the things that can be done as a first aid. And as I said, if any of these warning signs are there, definitely the child should be brought in and shown to the doctor. Now, when it comes to other treatment modalities in the hospital, especially for chronic abdominal pain, an important aspect of the treatment modality would be a multidisciplinary approach where we would get a pediatric gastroenterologist involved along with the pediatrician, the pediatric surgeon, and also a counselor. Because this, as I said, there is a dysregulation between the brain and the gut. So it is important that we enable the child to be able to handle situations that can cause stress, because stress can precipitate the whole thing. So a child could be having a difficult situation, for example, a school change, or could be having exams going on at school, could be something like sibling rivalry, could be having a problem interacting with a parent, or something that the child is unable to handle, and that painful stimulus is being sent to the brain as pain in the abdomen. So the child should be encouraged to undergo these counseling sessions along with certain therapies such as cognitive behavioral therapy, where the child is taught how to handle situations like this, how to handle emotions better, so that the child is able to go back to their normal lifestyle, attend school, and take part in the normal activities. Now, exercise tends to release a lot of endorphins, cortisol, which are normal pain relievers in our body. So it is good to keep these kind of children active. Allowing them to take part in physical activity is a good way of trying to reduce the pain, especially when they are not having the pain. Trying to keep them active instead of them focusing on their problem or whatever their stressor is a good way of enabling it. Dietary modification is another thing that can be employed. Usually, as we say, definitely a high fiber diet should be given. Occasionally, a lactose-free diet. Some children have difficulty in digesting milk. So sometimes if you avoid milk in the diet and see, sometimes that tends to help. Giving a diet which is rich, which promotes the good bacteria in the gut, that is probiotics, that is what we say. So for example, curd is good. That tends to produce a lot of good bacteria in the gut. So encouraging children to eat a diet like that is good. Indiscriminate use of antibiotics should be avoided, because antibiotics tend to get rid of both the good as well as the bad bacteria. So that also should be avoided. So these are some of the things that can be done to help these children, and management of these children with chronic abdominal pain is a long-term issue, and we need to continue to do it for quite some time. Now, what are some of the things that can be done to prevent abdominal pain in children? So to prevent abdominal pain in children, you are what you eat. So the most important thing is encouraging them to have a healthy diet, eating a balanced diet with fruits and with vegetables. Now, to start doing that, you need to start off when the child starts complementary feeding, that is at 6 months of age. So at 6 months of age, between 6 months of age and 1 year of age, the child should be trained to eat all kinds of foods or all groups of foods, so that at 1 year, the child starts having something known as family pot feeding, where the child is eating everything that the parent eats. So once we do that, later on, the child will be used to eating vegetables and fruits and things like that, instead of putting the child predominantly on a milk diet. So encouraging children to eat a balanced diet is extremely important. We need to avoid junk food and food that is very spicy and full of fat and things like that, that definitely should be avoided. And a balanced diet, including all the groups of food, should be given. The other important thing I would like to emphasize as far as diet is concerned is eating, meal times should be happy times. It should be happy times. It should be a time when the child enjoys being with the family. The child is bonding with the family. And this should not be a time where the child is forced to eat what the child does not want to eat. And you find a lot of parents coming and complaining that every day when feeding, the child will complain of pain and the child will vomit. And after that, the child is fine. See, when something like that happens, what happens is there is a danger of something known as food aversion developing in the child. The child starts correlating food with a bad experience. So, forcing a child to eat, a healthy child will have an appetite, and it is good to keep the food in front of the child. So whatever amount the child can eat, only that should be put on the table, on the plate, and the child should be encouraged to finish what is on the plate. So it should not be what the mother wants the child to eat. The child should decide how much of it to eat, but the mother can decide what the child should eat. So force feeding a child at any age can always lead to problems later on, especially food aversion. So that should not happen. The child should not be scolded and hit when the child is not eating. So that should not happen. So meal times should be happy times, and children should be encouraged to start eating on their own. So children like to explore. They might make a mess out of it, but still they love exploring. So get the child a plate with some kind of a cartoon character on them, and put the food on that plate and encourage the child to start eating on their own. And that is something that should be done so that the child enjoys eating instead of food being pushed into the child's mouth. The other important thing that should be done to prevent a lot of abdominal pain in children, especially infections causing abdominal pain in children, is promoting hand washing. So this, especially during this COVID season, it is very important that we encourage children to hand wash. So children should be encouraged to wash their hands before they come and eat, after they come back from play. So they are out playing, they should be encouraged to wash their hands and only then put anything into their mouth. The other important thing that should be done is their nails should be cut really short, because there is a tendency for dirt to accumulate below their nails, and when they go and take the food and eat it, there is a chance for infections, especially worms and things like that, to get into the abdomen, which can cause abdominal pain and problems. So hand washing is definitely something that should be promoted. One more point that I would like to say, especially during this COVID season, is COVID also can present with gastrointestinal symptoms such as abdominal pain. So just because a child does not have any other symptoms in the abdomen, that we cannot rule it out. So any child, who has been exposed to a COVID positive parent complaining of abdominal pain should definitely be looked into, because especially during this season, we need to keep our eyes open for that. So these are all the different ways by which we can prevent abdominal pain. Now, the most important thing that I would also like to say is, a child who is trying to escape an unpleasant thing. As I started off my talk, I was saying a child getting ready to go to school has got a test in the school that day, and all of a sudden says, I've got abdominal pain. So that should not be, and after you say, okay, you don't need to go to school, the child is out playing. If that is what is happening, that should not be encouraged. So if you encourage that, the child will continue to do that, and that is something like a positive reinforcement for it, and that should not be done. So you should not encourage that kind of an activity. So instead of that, spend time with the child. Give positive affirmations. Give child time. So that the child is able to open up with you, talk to you, and the child doesn't have to do things like this for attention. So many of these children tend to complain of symptoms like abdominal pain, headache, or pain in the leg, just as an attention-seeking behavior. So that should not be encouraged. That should not be reinforced. Instead, we can give time with our children, spend time with them, so that they don't have to resort to things like this to get our attention. So these are all some of the things that can be done to prevent abdominal pain. And the few take-home messages that I would like to say is, do not panic if your child develops abdominal pain. 9 out of 10 times, it is nothing very serious. Look for the red flag signs which will tell you that this is something serious in my child, and do not hesitate to bring the child to the hospital so that the child can be looked into and taken care of.
Questions.
I'm just going through the questions. Thank you for your questions. Saujanya Murlidhar has asked a question is why my child is not taking any food in the morning. He was 7 years old, but lunch and dinner taken by him normally. See, as I was saying, mornings are usually a time when the child is usually quite stressed out, because usually the child tends to get up late. And the child has got a whole day's schedule, probably has a test in the school, is running, it doesn't know, has to be on time for a school bus. So probably has to face teachers in the school. So there are so many things going on in the child's head at that in the mornings, So that is probably the reason why the children don't eat as much in the mornings as they do for lunch and for dinner. So the way to get them to do that is make sure that the child has got a scheduled sleep pattern. The child goes to bed early, gets up early, so there is ample time for the child to get up, get things ready for that day, probably use the restroom. So that is an important thing that the child should do. Most of the children are so rushed in the morning, they do not have time to go to the toilet. So, they are worried that if they eat, they might have to go to school and then they will feel like using the toilet there. So things like that. So usually the reason is because the children are rushed in the morning, and that is because they've had a late night, they go to bed late, they get up late, and there is no time for that. So that is the usual reason. As long as a child is eating well in the afternoon and in the night, it cannot be anything very serious. Deepa Shika Kota has asked, my daughter poops immediately after eating a heavy meal. Please advise. A good question. But the important thing that I would like to know there is how old is the baby? Young children tend to have something known as a gastrocolic reflex, where the moment they eat, they tend to pass motion, and that can be very normal. But if this is an older child having something like this, it could be because of an underlying problem, which should be taken care of. And so if you bring the child to the hospital, I'm sure the pediatrician will be able to help you out. The other question is, my baby 2 years and 1 month, he takes too much time to take food. He holds food in the mouth for 2 to 3 minutes, then eat it. Is it normal? Yeah, I guess it is normal. I think you should just allow your child to enjoy the food. Don't force the child to eat. If the child is chewing the food and swallowing it, but taking time to do that, that's perfectly all right. It's much better than a child swallowing the food, because sometimes we have children coming in and the mother's complaint is the child refuses to chew. Whatever is put in, the child just tends to swallow it. So if that is happening, that is more worrying. So if the child is keeping the food in the mouth and chewing it and slowly taking it, that's perfectly all right. Okay, so Deepshika says that this is a 6-year-old child. So maybe that is a cause of concern, and it will be good to get that checked up by a pediatrician. Thank you so much for your questions. I would also say that we have a website on which pediatricians at MGM have written a lot of articles, which I'm sure will be able to throw more light into a lot of topics involving childcare. So I would encourage all our parents out there to please go through the website when they are free. And do tune in next week again, because we will be having another interesting topic, a topic that would be of interest to you all, to answer your queries. Thank you so much for watching.